Welcome back, Titans. Today, instead of talking about a single drug and medication pharmacology that we've been doing lately, we are going to talk about an entire class, which specifically is antibiotics. So at this point in your lives, you have probably had a prescription for some antibiotic, which is used for bacterial infections. The CDC said in 2022, over 236 million prescriptions were provided by primary care physicians, internists, nurse practitioners, and PAs. So they are very widely used, have been used well over a decade, and will be continued to use as the best source to fight some sort of bacterial infection that assists our immune system. So what are antibiotics? Where do they come from? We've got our examples of our classes. For each one of these, we're going to go over an example of a medication you might see is a generic or brand name, the actions that they're going to be using, how to kill our bacteria, and then some of the indications like strep throat, UTI, those sorts of infections. So back all the way in 1910 was the first use of an antibiotic, but it wasn't until 1928 that Alexander Fleming in London discovered penicillin, which is still used today. So that was like the milestone of antibiotic use, especially from a natural form. So what is an antibiotic definition? On the Nancy Caroline 9th edition, volume 1. So Nancy Caroline says that these are medications used to fight the infection of killing the microorganisms or preventing their multiplication to allow the body's immune system to overcome them. Great. So we are using this in conjunction to help our immune system. So if we have a severe bacterial infection, the antibiotics are going to kill the bacteria in some way or prevent it from multiplying so our immune system can do its job. What kind of classes are there? There's different types of classes of antibiotics, and they each work in a slightly different way or similar way to help fight that bacterial infection and kill that cell. With well over 100 different types of antibiotics on the market, the most common you'll find are like amoxicillin, zithromycin, cephalexin, and stuff like Cipro. So let's talk about a few of them, starting off with aminoglycosides. So you can find these like Nebsin or neomycin. Those would be some examples of generic and brand names. How they're going to work is they're going to inhibit protein synthesis by binding to the ribosomes. And that's going to cause bacterial cell death. Remember, we said we're trying to kill the actual cell itself or prevent it from multiplying. As we go through these, you'll see some that are going to inhibit the DNA, some are going after the ribosome, some are going after the cell wall. Any way that the antibiotic can go in and help kill or prevent that cell from multiplying. What am I going to use aminoglycosides for? This can depend on the drug, but it can help plague, bone and joint infections, urinary tract infections, bacteremia, pneumonia, things like that. Let's talk about cephalosporins. So these are like the Ancef, Keflex, Zinacef, Rocephin, things like that you'll see on your patient's history. These are going to kill the bacteria by preventing the formation of the actual cell wall. Some indications for these are going to be skin infections, soft tissue infections, UTIs, respiratory, we got strep, Lyme disease, and sepsis. Okay, macrolides. So our macrolides, common ones are emycin, zithromax, you might see, or Biaxin. These are going to interfere with the protein synthesis in the bacteria by inhibiting bacterial growth. Some indications for these are going to be same thing like sepsis, endocarditis, maybe some sort of cardiac infection, so that's a big one to look out for. Sexually transmitted diseases, diphtheria, and upper bowel and lower respiratory tract infections. Penicillin's a big popular one. So amoxicillin, you have augmentin, bacillin, stuff like that. Penicillin G rather. This is going to kill the bacteria by preventing the formation of the bacterial cell wall. And a lot of the indications for these are going to be sinusitis, respiratory, skin, UTIs. And then some penicillins are used to treat anthrax, meningitis, diphtheria, syphilis, and even pericarditis. Our quinolones, these are going to be like your Cipro or your Levaquin, Avalox, you might see, or Floxin. These are going to kill the bacteria by inhibiting bacterial enzymes needed to replicate the bacterial DNA, thereby preventing the bacteria from multiplying. Some indications for your quinolones are going to be same thing, vary depending on the drug. But uses include UTI, septicemia, pelvic inflammatory disease, soft tissue and skin infections, typhoid fever, things like that. Our sulfonamides, you might see these as like the Silverdene or the Bactrim, Septra, things like that. This is going to inhibit the ability of the bacteria to produce a form of folic acid that is necessary in the proteins for the bacteria from multiplying. So working in a little bit different way. We're going to use these types of bacterial pneumonias and protozoal infections. We have our tetracyclines. So our tetracyclines, you might have heard of doxy or doxycycline before, things like that. Minosine. This is going to inhibit the protein synthesis in bacterial cells, hindering the growth. Indications for our tetracyclines, still depending on the drug you're using, but it can be used for Rocky Mountain spotted fever, chlamydia, gonorrhea, rosacea even, anthrax, and even cholera. So, hope this helps. Remember the entire goal of our antibiotics, and they come in a bunch of different forms. It can be IV bag, it can be in the pill form, it can be taken for 3 days up to weeks, is to kill the bacteria. We should also mention that antibiotics sometimes are used inappropriately or misused and can lead to some sort of resistant strain like VRE or MRSA. So that's also something to watch out for when you're doing your head to toe on your patient. You may see an open sore that is MRSA in origin. So hope this helps. Remember, we were trying to kill the bacteria. See you on the next one.